Okay, so we're talking about STIs today. Let's get this. So just a brief outline. We're just gonna look at where Louisiana is nationally. But you can look at a more comprehensive version of that on Moodle, I guess is all I'm saying. But we're gonna look at some statistics, and then we're gonna go over 6 STIs. 3 bacterial, 2 viral, and 1 parasitic. So all the classes of pathogens. Chlamydia, gonorrhea, syphilis, HPV, HSV, and Trichomonas vaginalis are the ones. So sexually transmitted infection, this is not earth-shattering to people. It's just an infection you get from sexual activity or blood exchange. Honestly, like if there's some STIs that are transmitted through like needle exchange stuff, and some are transmitted directly from mother to offspring, right? But we'll talk about that. Many are curable. Again, like 3, you can imagine we have antibiotics for the bacterial infections that are pretty good. Generally speaking, though, these STIs, especially bacterial STIs, can cause some damage that if you don't get them treated early, then they cause some damage that is not going to be fixed by antibiotics. All it takes to get an STI is to have sex, vaginal, oral, penile, or blood exchange, right? So that's what I was talking about with the needle exchange, or needle sharing, I think is the technical term. Many infections are asymptomatic and have no signs or disease, and that's generally like maybe superficially good to hear, but what that means is that it can be transmitted across a population without people knowing. And so like you think you're good and you engage in sexual activity, and then it's like shared to all your sexual partners, and then it's like a problem because what's asymptomatic in you might not be asymptomatic in everyone else, right? By strict definition, an STD only refers to the symptomatic infection, right? So we all got this lesson with COVID, right? COVID is the disease, while the cause of it is SARS-CoV-2, right? So infections and diseases are very different. Same applies here. Same line of logic, where it's the STD is the actual symptomatic disease, while the STI is the infection itself. And so here's a quick Louisiana rank. So you can see here that the progression of so the trend is still continuing for all of these. So the up until 22. I didn't check 23 or 24 yet, but you can see that we got a little bit better in syphilis in Louisiana. I went from 12th to 11th, but with congenital syphilis, it got significantly worse. And then a slight improvement with chlamydia and gonorrhea to where, but importantly, you want to look at the number of cases, right? So the number of cases have gone up in every single category, but just they may have gone up in other, like in one more state, and so we dropped a ranking. So it's not like we have decreasing rates. We still have the problem is increasing, but it's increasing at a slower pace than maybe other states, which is I guess depending on how you look at it, either a good thing or a bad thing. But generally speaking, this is still a very problematic thing in Louisiana, but all over the world, honestly. Syphilis, gonorrhea, and chlamydia are reportable to the Department of Health. So when people get diagnosed with that, it is reported. And importantly, gonorrhea is developing antibiotic resistance to where, just like many other bacteria, we need to have a continued effort to develop antibiotics so that it gets better. That's annoying. Whatever. Okay, so the first one we're going to talk about is chlamydia. The route of transmission: blood exchange, vaginal, rectal, oral sex transmission in newborn during delivery. So this is a very, very common transmission strategy for bacterial STIs. Most cases of chlamydia are asymptomatic. That's what I was looking at. I don't know how to. Maybe I can unplug it. There you go. Simple. Boom. All right. I was hesitating because like sometimes you unplug those things and they just like it's like explosion of volume and you made it way worse. I don't know how technology works though. All right, whatever. So we have chlamydia. Where are we at? Yeah, so it's asymptomatic, and screening is an important tool, right? So the theory is very similar to SARS-CoV-2, that right you want to screen people so they don't transmit to other people on a regular basis. So you lower that degree of asymptomatic transmission, and so that's the theory here. So screening is an important tool to prevent spread. This is the most frequently reported bacterial STI in the United States. That's why we're talking about it first. Women, the most common site is the cervix, while the most common site of infection is the urethra in men. But both men and women have other sites of infection, like the epithelial cells of the conjunctiva. So the eye. So that's another like symptom is conjunctivitis, right? Which is pink eye. So I think that we see that later on. But also the rectum and the throat, depending on the route of transmission. Infection is usually asymptomatic in women. So the next one's gonorrhea. The infection's also asymptomatic in women a lot, and symptomatic in men. And symptoms usually appear within the first 2 weeks after infection, which is a typical growth time for a lot of bacteria. Takes about 2 weeks to get from low levels to detectable levels. So it's like
This is kind of stupid, but like with these bacterial infections, can they like go away on their own, or
like your immune system fighting it?
Yeah.
These usually, if they can go away on their own, it's like you got infected and they got removed to where nothing was ever even known, or like. Usually, if it gets to the point where you're starting to show symptoms, or they did establish a stronghold. In pathology, there's this concept where you have to have a minimal number of the pathogen to actually initiate an infection, because of probability curves, and it's very complex. But it is not impossible to get exposed to an STI and then not get infected. But it's very hard to make those claims scientifically, because it's like, how do you how do you know that someone was exposed to it if one little bacteria came in, your immune system destroyed it, and then nothing ever happened. But usually, I guess to more directly answer your question, usually when bacteria infect people, they encode a whole bunch of ways to either get around the immune system, or prove it ineffective enough to where it's replicating in the face of the immune system, or it's replicating in a niche that is not really exposed to the immune system as much. Now, for sexually transmitted infections, there's still a good bit of the immune system around the urogenital tracts, and so it's like these infections usually they avoid immune system contact, or exposure to the immune system, to where they replicate stuff, and then your immune system can't really come in and destroy them. So usually they don't just resolve by themselves. I'm sure there's some rare
Which is
instances
crazy,
where
though,
maybe
because
they can.
there might be someone who does not go to the doctor at all, and they're just walking around with like chlamydia, and
Oh, for sure that
it's
happens.
crazy.
Yeah. Uh-huh.
Like, cause how wouldn't you know, like your body?
Um, Probably what's going on with asymptomatic people is that their immune system's at least keeping it a little bit in check. But that certainly doesn't mean, and what we'll see later is that a lot of these, especially the viral STIs, they go into a period called latency, where they're straight up just hiding from the immune system at a genetic level, even. And we'll see that with HSV1 and I forget if HPV goes into latency or not. I don't think it does, but yeah. So we'll see. It's an extremely complicated system, right? I mean, this is people that dedicate their whole lives to infections, right? And so it's like understanding it, and so there's a lot of ways that bacteria can get around things, and they're constantly surprising us, at least experimentally. Regardless, where are we at? So gonorrhea, it's usually asymptomatic in women, so that symptoms appear within the first 2 weeks after infection. So yeah, the most common site for men is the urethra, and the most common site of infection for women is the cervix. Both men and women may have infection at non-genital sites, conjunctiva again, rectum, throat. So untreated gonorrhea can spread through the bloodstream, disseminated gonococcal infection. That's what that is. And it can cause arthritis, joint pain, inflammation, and multiple skin lesions, as you can see in these pictures. Right? You don't get an STI by getting infected through the skin like that. It's through the urogenital tract that then gets inside the bloodstream and then spreads outwardly. So for both chlamydia and gonorrhea, we see a lot of overlap, right, with the way that they can kind of go they have a lot of asymptomatic spread. They're both bacterial infections, and so people look at these kind of together. So as far as chlamydia and gonorrhea in men, the major thing is urethritis, which is just inflammation of the urethra, right? And you'll also see this penile discharge, often purulent, and they call it milky. It's not really, obviously, it's not milky. People call any white substance kind of milky like that, but this is bacterial latent, right? Discharge. So what you're seeing here is it's actually bacteria that is in this discoloration. Non-gonococcal urethritis, its most common cause is chlamydia here. So, and signs include increased frequency, polyuria and pain with urination and painful ejaculation. So, what you're going to be kind of tasked with while studying this is just keeping all the similarities and differences between gonorrhea and chlamydia separate, because there is a lot of like similarities within this and these two chlamydia and gonorrhea, right? There's a lot of similarities here. So just making sure you keep straight all of the similarities and differences, what just applies to one of the bacterial infections and what is to both. Okay, so as far as in women, there's cervicitis, which is just inflammation of the cervix. There's a mucopurulent endocervical discharge and cervical bleeds when probed. So it very much disrupts that the solidity of the barrier there. And so if there's just simple probing, then it's discharged. There is easily bleeding. There's a small percentage also include infection of the urethra. And you have the same thing with women as in men with regard to polyuria and dysuria. Pregnant women also have an increased risk of preterm delivery, premature rupture of membranes, and infants born vaginally become infected. So this is the transmission of mother to offspring that I was talking about earlier. And there's a risk of conjunctivitis, pink eye with the baby, or pneumonia, specifically with chlamydia. So untreated chlamydia and gonorrheal infections increase risk of pelvic inflammatory disease in women. So all this is just chronic pelvic pain, increased risk of ectopic pregnancy. So it's just a lot of pelvic pain. It's you can see here that we have this inflammation that's occurring, especially compared to the normal fallopian tube, and just what you're kind of starting to see now, at least in this class, is that when you have inflammation and things are bigger than what they should be, it disrupts it. That's when pain sensors are triggered, and so that's all what's going on with PID. Cure of chlamydia. So you want to cure this with antibiotics, obviously, which work pretty well, but you have to make sure that you get it as early as possible because late treatment can cause some organ damage. And then we're going to shift this to where y'all don't need to have drug names memorized, to where y'all don't need to know specifically which antibiotic goes with which one. Just know generally antibiotics treat bacterial infections. Fair enough. Erythromycin and amoxicillin. Amoxicillin is just a penicillin derivative, so it still has that beta-lactamase inhibitory effect. And then gonorrhea is treated with a tetracycline, which we're not going to go into all that. Do y'all go over antibiotics and pharmacology?
Yeah.
Okay. Yeah, so y'all get kind of some exposure. All right, so screening and diagnosis. Diagnoses 1 of groups recommend screening for all sexually active women under the age of 25 because women are asymptomatic pretty easily, and so regular screening is a good idea. Vaginal swabs or health professional collected endocervical samples, and then so that's for women, and then for men to test, you want to have a first void urine, and all that is a urination in the morning before as the first urination of the day. The reason why they do that is it gives the bacteria roughly about 8 hours, which is how long you're sleeping at bare minimum, to assuming you go to the bathroom right before you go to bed, to grow, and then it becomes more detectable in diagnostic tests if it grows a little bit and provides more antigen for these to collect. All right, so another one is syphilis, Treponema pallidum. Is the causative bacteria, but it's just kind of affectionately called syphilis. Transmissions, as you'd expect, so direct contact with infectious lesions during vaginal, anal, or oral sex, transmission across the placenta during pregnancy as well. So that's different than acquiring it through the birth canal, right? And so it's a fetal infection. So make note of that. The diagnosis is looking at with microscopy of lesions exudates, but mostly it is serological tests, which means just taking blood samples and seeing if there's antigen there. So you can detect antibodies against it that are elevated in response to multiple types of infection assays. So there are a whole bunch of different stages of syphilis, and this is when it's going to get gross. If it hasn't already, the primary stage is where you just have these localized sores. The secondary stage where it's disseminated and you have systematic illnesses. So syphilis is one of the bacteria that go into latency that I was talking about, where you still are infected as an individual, but there are no symptoms because it's gone silent. It can go silent for multiple years even. There's but that's kind of an intermediate stage. That as far as progression though, the next stage is this tertiary syphilis where you have severe medical problems, consequences of long-term exposure. And syphilis can also get to your brain, which we're not really going to talk about a ton. Just this little sentence right here. Any kind during the course of infection where it causes meningitis. And you can have vision or hearing loss, dementia, loss of motor coordination.
Al Capone had hard childhood.
Believable.
Yeah, I think it was like
Al Capone's like
the mobster from like the night he did the Valentine's Day massacre.
I have to forgive my mob history, lack thereof, I guess. I'm not big, like crime podcasts and all that. I'm not like into that at all.
Why not? Yeah.
It's like boring. Oh my God, it's crazy. It's like, why do you care about this random dude who?
Absolutely. I mean, it's not about caring. It's just like about what they've done. Like John Gotti.
It's not boring to you though.
No, it's not.
Like, what do I need to do to protect myself?
Right.
But
it's informative, kind of.
But like, what are these people doing? Like walking, like it's like you can't really protect yourself against someone who wants to.
They should put more emphasis on the victims rather than the actual murderer.
Okay, I'll agree with that. That would be better because then you actually are trying to probably do something good.
Sometimes they try to glorify the murderer.
Yeah, there's people. Dude, there's this girl who she got like a tattoo of like 3 serial killers, like their faces, and it's like red flag, at least in the dating world.
I'm screaming.
In any world, yeah. Like, you're not technically doing anything wrong, right, by getting a tattoo of these people, but it's like, what's going on there?
No,
it's probably just a glorification.
Wrong, it's just more the glorifying.
Yeah, I think that's what's going on.
Where's your braid?
Yeah, but long story short, I don't know really a lot of famous criminals. Like, I don't think I could name you one.
So Al Capone had syphilis and gonorrhea. Yeah. Jeffrey Dahmer, Richard Ramirez.
Like, I've heard of those in songs, but I couldn't. So if you were like, who's Jeffrey Dahmer, I'd be like, I don't freaking know.
So you don't know anything about Jeffrey Dahmer.
But what's that song that's like, I'll eat your heart out?
Oh, yeah, Dark Hearts by Katy Perry.
Sure, yeah. Like, I've heard those references before, but I don't know who Jeffrey Dahmer is.
Watch the Jeffrey Dahmer.
I'm not going to watch it. It's boring.
No, it's not boring. I promise.
But anyway, maybe Al Capone had syphilis.
He had syphilis and gonorrhea, actually. Okay.
Which is a great example. Which is a great example of another concept in pathophysiology of STI comorbidity. There's a lot of like diseases that, especially STIs, that if you get one, you're probably exposed to the other because they're acquired in conjunction. I don't think.
A lot of the patients that I've seen when I'm doing the HIV stuff, they have HIV and they'll have syphilis.
Yep.
As well.
So that's like the most famous comorbidity that people have with STIs.
And a lot of elderly people have syphilis.
I was strategically trying to avoid STIs in nursing homes because it is a disturbing thought. But a very, very common public health problem that nursing homes have.
Syphilis and gonorrhea, and he was also a cocaine addict.
Yep.
Which perforated his nasal.
Well, there you go. So maybe he had primary syphilis, or he went through that stage where it's where you have these chancre at the sites of infection, and what that is it's So that's referring to what the sore looks like. It's a painless sore, and it's mostly associated with syphilis. So this is like a symptom. There's like some cancers that also say that there's chancre, but it's mostly a thing associated with just syphilis, where you have this painless, round, firm lesion appears around 2 to 6 weeks after infection, and they usually go out on their own, and then it's like an early latent stage where it's before anything goes into latency. Latency usually happens within about a year, and these are primary syphilis is considered contagious severely. Yeah. The It's like distractingly disgusting. The secondary syphilis is also very contagious, and this is where just the disease has progressed further. Develops usually after that 1 month of infection. Between 1 to 2 months, you have a systematic infection at this point, so it has spread to other areas of the body, and you start to develop things like lesions on the hands and feet. Skin rashes. On the palms of the bottom of the feet and the trunk of the body, you will have fever, mucus patches, genital wart-like lesions, fatigue, swollen lymph glands. Symptoms usually disappear on their own, and these are very contagious, right? They contain spirochetes. The causative agent of syphilis is a spirochete bacteria, which is just the shape of the bacteria, right? So that's just saying it contains the bacteria. And then it can develop into tertiary syphilis, which is albeit rare but severely impactful. Usually occurs between 10 to 30 years. So that intermediate time is what we'll talk about, is that latent period where it's like you still have the infection, you can still be contagious even, but you don't have a lot of like signs and symptoms as far as lesions and warts go and stuff like that.
30 years is crazy.
Yeah.
Like insane.
Yeah, I mean it's people who, if you got infected when you were 30, you're now 60 years old. It's crazy. That's like your whole life. Right?
He had encephalopathy.
Oh, okay.
From syphilis.
Much like Al Capone, I guess.
But that's
I had a.
The stigma against this, like the fear and the stigma of the
it's
stigma,
not
it
the
is what
like.
keeps people from being tested and treated.
Yeah, sure. I agree.
I mean, I guess. But I mean, fuck.
And like with HIV, you can live a long life. You can be undetectable.
Yeah, it's not like a
and
death
you're not
sentence.
gonna
Like
spread it to other people.
Yeah, like Magic Johnson.
yeah, it's not like a death sentence like it was in the
It's
80s, you know.
You can live a long, happy
And
life.
there's a lot of like prevent, especially with HIV.
And
There's
we're here in Louisiana where people are not as medically inclined, so they think that they can eat off of spoons of people who are infected. They're just ignorant.
Yeah, it's like public education's important, I suppose.
Oh, absolutely.
Right. I feel like the STI thing has become like, breaking.
People are talking about it better,
yeah.
But it's still not perfect.
Yeah.
What am I?
We have these older people, like I don't know, like my dad one time, he was like, don't be sharing spoons with people. I'm like, that's not even how, the disease process works.
There's some
I'm
diseases.
Like, you have a science degree.
There's some diseases that can be transmitted that way,
saying,
but
STI specific.
oh, yeah, STIs,
don't.
Or
something like that.
Very rare.
Well, I mean, I got on the phone maybe like 3 weeks ago with one of my friends, one of my homegirls, and she was like, "Yeah, I caught chlamydia chlamydia like 2 months ago." And I was like so devastated, and it's like you just don't know like what to say.
You gotta feel for people, yeah.
Yeah, it's like I mean I never like right, you're like. But you don't know what to say, you know what I'm saying? Because it's like you don't know how it's like affecting them, especially.
I really don't know. I mean, I had gonorrhea when I was 18.
Okay.
I got rid of it.
There you go. Yeah, my uncle. My uncle had just took antibiotics, I imagine.
Yeah, I just took it. They gave me an antibiotic shot, and it was done.
There you go. Yeah, my uncle died of an HIV infection back in the 80s, and it's just so different than it's just so different than like today's, because it was just like a.
Back then, it was a death sentence. You get pneumonia, and then you die.
Mm-hmm.
But now it's just like you can actually get treatment for it, and they can treat all symptoms.
Mm-hmm. So anyway, infection of the brain and spinal cord. Yeah. So tertiary syphilis. So this is where it's just progresses to really, really bad, right? You have a whole bunch of
I didn't mean to make anybody uncomfortable. I'm sorry.
Yeah, we'll just. So it's just I don't even know where we're at on this slide. You develop these really bad rashes, and it can be fatal. And these lesions can be contagious, and obviously they contain these spirochetes for spread. And these spirochetes that when they subsequently infect other people, that's how they spread. Congenital syphilis is another big problem. Increases in cases of syphilis between 2000 and 2001 in Louisiana. And so here we require screening and so screening at the first prenatal visit and the third trimester of all women. And these things are treated with antibiotics, right? So penicillin or penicillin-like derivatives are very effective. And that's for the congenital syphilis. So those are all our bacterial STIs. We'll regroup and we will go into viral STIs here. So we're going to be talking about human papillomavirus and herpes simplex virus. HIV could be another. There's a whole bunch of them, but HIV could be another easy one that we could add to this. But I just didn't go into all of the every single STI.
I think she's laughing because you're a guy.
Who?
Oh. I think she's laughing because you're a guy, and I know it's probably like kind of awkward. It's a class.
Well, the thing is, probably for most guys, but the thing is that I've got 3 older sisters, and then I've got 2 other stepsisters, and then I was raised by my mom mostly, it's just all women in my life, to where it's just like whatever to me at this point.
I would say to everybody, because I want to break your stigma.
Yeah, I mean,
it's not anyone's fault that they caught
there's some weird social stigmas in the
There's
world.
a lot of things. I mean, I do kind of feel bad for people.
And that's the reason why the rates are so bad. Because people are not open about it.
The contributing factor.
They have chlamydia, they get treated, and then they don't tell the rest of the other partners that they have it. And it's like, what the fuck?
This is why people get killed. Seriously. No, because just imagine,
Yeah, I meant
faithful to someone, and then they come home and give you something, and it's like you have to live with this for the rest of your life.
Mm-hmm.
You know what I'm saying?
Yeah, and hiding this kind of stuff is not a good thing.
No, sure. It's not a good thing.
So, anyway, we got HPV. So HPV is a virus, right? Where it is, so it's an obligate intracellular pathogen here. And so what's happening here is that you get infected with these viruses and then they enter into your actual cells. All the bacterial infections we talked about were all extracellular pathogens, right? So this is entering into your actual cells, and so this is infecting the actual tissues that make up these sex organs and your genital tract. And so what happens here is that it's transmitted through vaginal, oral, and anal sex, and it can go hand to genital contact as well. So HPV can infect layers of the skin, where it can, and that's how it infects these like congenital war. I don't know where it says it. Now we'll get to it later. The 90% of sexually active men and 80% of sexually active women will be infected by HPV. A lot of asymptomatic infection here. Most people clear the virus within 2 years, but around 10% have persistent HPV infection. There are a ton of different types of HPV based off of, these are like sequencing the actual HPV genome. Yeah, it's a DNA virus.
What's a DNA virus?
I think HPV is.
Oh.
Oh my gosh, is HPV a DNA or an RNA virus? I should really know this. I think it's a DNA. HPV. Most common is a common DNA virus. Yeah. So, okay, sorry. Yeah, so it's a. Okay. Yeah, so it's a DNA virus. So that just means that the genetic information that's stored is the DNA. So they sequence this DNA, and then you can kind of classify it in different types. Now, there are different levels of pathology based off of what type of HPV it is. HPV 6 and 11 cause a lot of genital warts, but it's a low risk HPV for actually getting cervical cancer. But HPV 16 and 18 are the two major ones that cause the most cases of cervical cancer. So this is the problem. What HPV has is it expresses a whole bunch of genes that cause those mutations that we actually talked about in the cancer lectures, where it can inactivate things like RB and P53 and cause them to be ineffective in controlling cell growth, and so these cells will then just become cancerous, and that's how women develop cervical cancer. Cervical cancer in women, if you look at it, almost all cervical cancer is caused by HPV infections. There are very few cervical cancers that aren't caused. It's like 99%. So it's what the theory is that if we can prevent HPV from spreading, then we can drastically lower cervical cancers. It's like almost a direct causation there. And the big way that people do this is by trying to vaccinate. But I don't know if we're going to go into that. Maybe later. So what we see here is that we get these warts that accumulate. And these are often painless. And so what this is these are cell types that have been infected and that have growth that have been upregulated, where you just have increased growth and it's actually just growing so much in that area of the skin that it's growing outward. And then unless it's on the bottom of your feet, in which you're constantly applying pressure upward, and so it's like growing inward. It's called like a plantar wart, but that's something. For these genital warts are just growing on the outside of skin, outwardly on the genitalia. Flesh is colored with a flat cauliflower-like appearance. May also commonly be brown or colored. And these warts are contagious insofar as there is viral release out of these skin, to where if you can wear condoms and provide that barrier, then you can reduce the risk of transmission. Diagnosis is mostly going to be confirmed by biopsy, to where you can take a look at these warts. There's warts that kind of pop up in, we've already seen it with different STDs, but then also various conditions. It's different viruses, not always HPV. So you want to confirm that that there's a certain virus that you get infected with. And you could do that with just genetic screening. Treatment is cryotherapy. This is where you just freeze off the warts. What you're literally doing is you're just killing off all the cells that the virus has infected, and because the viruses don't replicate unless they're within cells, right? And so if you kill off all the cells, then you can remove all of the virus there. Laser therapy, chemical removal. There are antivirals, I think is what they're referring to by chemical removal, and immune enhancers, which help target the immune system toward these cells. And what we learned, right, is there's certain cell types that then control intracellular pathogens. So things like NK cells and T cells are going to be targeting these cell types. But again, HPV has evolved multiple mechanisms. It's got a really big genome. It's evolved multiple mechanisms to avoid the immune system, to where there is a fight between virally infected cells or the virus and the immune system. Genital warts due to HPV can reappear after treatment, right? And so you have to, and that's just people missing, like if you freeze off all the warts, if you miss some cells that are infected, then it's they can reappear. But you can just keep treating until you try to remove all of them. So HPV 16 and 18. So the risk here for these types are cervical cancer and other types of cancers, oropharyngeal, anal, vulvar, vaginal, and penile cancers. So these can take, the way that HPV progresses, it needs to like express the genes and in an effective enough manner to where it actually causes uncontrolled cell growth or unmediated cell growth, and so it can take multiple years and decades to develop these to develop cancer after initial infection. So there's constant screening of people, and the screening that's done is the pap smears that you take a biopsy of the cervix and then test it to see. You can test to see if there's cancer that's growing on there or not. And it's at a higher risk for Black and Hispanic women as well, which is probably an educational and not a genetic reason there. So early signs and symptoms of the cancer is vaginal bleeding, pelvic pain, watery pink vaginal discharge. You can also get oropharyngeal cancers. No screening available, and the rates of HPV-linked cases have been increasing. And you'll get sore throat, dry cough, and voice changes. So I mentioned that the major way we try to combat this developing cervical cancer is by preventing the virus that causes it, and then because there's such a correlation between the cancer and the viral infection, having a vaccine is very helpful, and that's, I imagine most people have heard of this Gardasil 9, and it can prevent infections of the major strains of HPV that cause cervical cancer, which is 611, 16, and 18. Prevents infection of 5 other HPV types that are also high risk. So the CDC recommends that HPV vaccinations at between 11 and 12 for all children, whether they're male or female. This used to be like just female that got vaccinated, and then it's dumb because it's like, how do you think women are getting these? It's spread through asymptomatic men, right? So it's vaccinating all people. You can drastically reduce these risks. And then the reason why 11 to 12 is that like you can't really determine how sexually active women are going to be by the time that they're in their teenage years. And so if you can just nip it in the bud before any sexual activity happens, that's kind of the aim of having between 11 and 12. And so that's the age choice there. Right, and so you're prior to becoming sexually active. It doesn't eliminate the virus if vaccine is given after the person is infected with HPV, right? Makes sense. All right, and the next one we're going to talk about is HSV, or herpes simplex virus. So this is one of the herpes viruses that's related to chicken pox and the pathogen I study, which is HCMV. But this one is an STI, rather. All the other herpes viruses are not classified as much of an STI as HSV or herpes simplex virus is. And most people with HSV are asymptomatic, like pretty much all herpes virus infections. But there are two different types. There's HSV1 and HSV2. HSV1 is the cause of most oral and labial infections, while HSV2 is most genital infections. So there is a distinction there. Most people with oral herpes contract it from non-sexual contact with saliva in early childhood. This is like mothers kissing their babies does downstream infection. This isn't typically fetal infections, right? Which is a lot of herpes viruses are transmitted through saliva with that mother to child contact, and there is a lot of infection of young children of herpes viruses. But and HSV1 is just a great example of that. With HSV2, you have that's mostly genital infections, and instances of genital HSV1 infections are increasing now.
That's a big one in that room.
HSV1
No,
or HSV2. I haven't seen that, but I trust you. You know what I'm saying? It's like
I've only heard it.
You've only heard it? Yeah. My general thing is pretty much all over the state, but especially northern Baton Rouge. Just STIs are bad. To where I'm not really shocked by statistics saying it's bad in Baton Rouge at this point. Regardless, diagnosis, physical exam, and then viral culture from the lesions. These you just put it on various cells, and then you can identify what they are. You can also screen by it through PCRs and genetic or other genetic tests, but it's pretty obvious.
You can only like test for that if you're having an outbreak, right?
I don't know. Maybe. I mean, maybe I think.
No, you can test.
Oh, okay.
It'll show like an antibody. It could still be dormant, but you can.
Right.
There you go. Yeah. Yeah. Antibodies are great because HSV. Do I have it here? Yeah, I do. So there's with herpes viruses in general, HSV1 being a great example of this. There's this initial primary infection, which is where you have the most outbreaks, and this is where you can develop blisters, and then those you can even have those herpes like sores. You know what I'm talking about? Yeah, cold sores. That's what I was looking for. And that'll pop up in the initial episode, and then typically what happens is that you can also have prolonged clinical diseases and flu-like symptoms can develop. Flu-like symptoms are just very common that your immune system's been activated. But what happens with these viruses is that they go into a latent stage. And this is where they're just hiding from the hiding from the immune system, where they're going inside of the nucleus, and then they're just establishing residency genetically. There's not a lot of even there's not a lot of actual HSV antigen being made within the cells, and there's no active replication. And it's this latent stage, and HSV establishes it in the ganglia, and they are inactive, and because there's no antigen, it is asymptomatic. But what'll happen is that it'll reactivate from latency, and can recall, and you can actually have these like random cold sores that pop up. Happens a lot in winter times and when people become stressed. They think that your immune system. There's a weird fight between herpes viruses as well, where it's like these viruses are constantly trying to come out of latency, probably, but the immune system constantly just dampers them down. And so if your immune system gets turned down, like it does when you get stressed in tests and stuff like that, you have this viral reactivation that occurs with a lot of herpes viruses, and so that's what'll happen there. But regardless, it's going to be accompanied with flu-like symptoms whenever there's a reactivation, because that's just your immune system releasing mostly interferon is what you're feeling with those flu-like symptoms. Triggers for reoccurrence is illness, stress, sunlight, fatigue, and menstruation. All right, so for genital herpes, there are antiviral treatments for this one. The major one being acyclovir, which y'all don't need to know. It is a nucleic acid mimic where the virus integrates this instead of normal nucleic acids, and then I think it's a chain terminator if I remember correctly. But acyclovir is a very effective herpes drug, but y'all won't need to know that. Just know that there is antiviral treatment for HSV. Intermittent therapy, taken at onset of outbreak, shortens. Have y'all learned antivirals too? A lot of people don't even know that antivirals exist. The amount of times I've had people ask me, do antivirals exist like antibiotics? And I'm like, yeah, that exists. But y'all haven't talked about antivirals? Interesting. Mentioned it briefly. Well, y'all can hear it here. Antivirals are a thing. It's not just vaccines that help us. Yeah.
I know Tamiflu is antiviral.
Tamiflu is an antiviral. Yeah. It's that one links the neuraminidase to what's called a sialic acid sugar, which is we actually talked about with in the cancer lecture. But yeah, and it prevents. It's actually really smart. It prevents the virus goes into cells, it replicates, it assembles, and then it releases. But the virus critically needs to like cleave off that with Tamiflu. And what Tamiflu does is it prevents that like to where it's made and it's like sitting on cells, but it's just not released out into the environment. It's a really smart drug that's made, and it's very specific toward flu. But yeah, so yeah, Tamiflu is a nice little antiviral as an example, though. Regardless, condoms and suppressive antiviral medications for infected decrease the risk, right? Doesn't prevent fully, but it decreases the probability curves of spreading the infections. And HSV is most contagious during active lesions present, but can spread when no lesions are present. So there's asymptomatic viral shedding, which is COVID does extensively. So a lot of people talk about that with COVID.
Hold on. So you can spread this even without having an outbreak.
Yeah. Yeah. That's what I was saying, I guess. Is that shocking to you?
Yeah.
Okay.
I thought it was really contagious, like during the.
Well, it is. It is more contagious during outbreak.
Right.
But it's not impossible to spread if you don't have any signs or symptoms. There's asymptomatic shedding. Yeah, I guess it is more shocking with viruses than bacteria, I guess. Mm-hmm. But I guess viruses are just so small, and I think you need less virus to actually like get infected than like something like a bacteria, to where like it's probably easier for asymptomatic shedding of viruses in general. But yeah, no, for sure you can transmit with asymptomatic shedding. There's also neonatal HSV infections. So this is where virus is transmitted to newborn during vaginal delivery. Kind of imagine what's going on there. Just the virus is just infecting the children. And it really pops up in the eye. You can see in these pictures the eyes and the skin where you develop these like rashes. But can disseminate and spread to the central nervous system, right, which is where these viruses go latent. So you can establish latent infection pretty much your entire life. But there is antiviral therapy, and it should be reported within Louisiana. Condoms used by partner through pregnancy if HSV is in its history. Women with active genital herpes at time of delivery should be delivered by C-section. So that's the way that you can kind of prevent that. Make sense? All right, and the last one we're going to talk about is Trichomonas vaginalis, which is a flagellated protozoan. So it's not a, this is like the third class. Well, I guess there's four technically. These are parasites, and they're best noted by their flagella, which helps them move. But this is an STI is caused by parasite transmission, skin-to-skin contact during vaginal, oral, and anal sex, and then condoms reduce the risk. So hopefully you are picking up on that trend. This is why condoms usage is so like advocated for by people in healthcare, that you just reduce the risk for bacteria, viruses, and parasites now. So in men, it resides in the urethra, but is mostly asymptomatic. It's more common in women than in men, probably because it's harder to detect in men. But in women, it causes this vaginitis, which is just inflammation of the vagina, and then there's this vaginal discharge, which is usually greenish, or I guess yellowish too, but greenish, frothy, and purulent as well. And there's pain with urination and sex, and that's usually what happens initially, where people have, and that's why people might go to the doctor, is because of those symptoms. Symptom in men is a lot less severe, kind of, but there's burning and urination and penile itching and then penile discharge as well. So it's not completely asymptomatic, I suppose, like I said. The diagnosis is a wet mount, where you're just trying to take a sample, and then you're trying to just detect, are there flagellated parasites in that. It's called a wet mount because you're wetting actual. It's like you're mounting actual secretions rather than like a biopsy or anything like that. And so you're just looking for mostly these flagellated cells, because under a microscope, like, cells can kind of look like this, especially like immune cells, but these flagella don't really exist in the immune system and stuff like that. And so it's very easy to tell these flagella. And then weirdly, and I don't get it fully, but you actually treat these eukaryotic cells, eukaryotic parasites, you actually treat with antibiotics, which you should be thinking it doesn't make sense, and because like a lot of these antibiotics target bacterial processes, but with this one, there's a resident bacteria that lives in these cells, and so if you can target that bacteria for killing, apparently it depends on the bacteria to make certain critical nutrients for survival of the parasite. And so if you kill the bacteria, you then kill the parasite as well. And that's how you can justify this. But y'all have to memorize metronidazole or whatever that is. All right, so yeah, you can kind of see a lot of trends in the STI lecture, where STIs are very much a thing. You can lower the risk by condom usage. Sexually transmitted, that can also go into latency. But yeah, just like we said in our big diatribe there, it's about awareness, preventing, and testing, to where we're getting rid of the bad negative stigmas of STIs, and it encourage better health practices by the population in general. There you go. There you go. I'll tell my friend. One of my best friends is going into public health currently, and so it's a good thing. All right.
That wasn't so bad.